Hi family, welcome. This conversation is about the challenges the male go through, then how we provide solutions to men. By giving significant challenges, the mitigation including 1. Heart disease, 2. Cancer, prostate, lung, colorectal. 3. Stroke being leading cause of death. A. Sexual/reproductive health include erectile dysfunction, low testosterone, prostate issues. Lifestyle habits, higher rates of smoking, risky alcohol consumption, poor diet options, omega-6, wheat products, sugar/high-carb diet. Men take up jobs with higher physical risk, pose lower expectancy. Men are less likely to visit a doctor for regular checkup. They send the wife for antenatal clinic. Once she is declared healthy, that is the end. We are healthy, the wife is the health litmus paper. This lead to late diagnosis of illness or report the symptoms early. How does cancer harm men's health? Cancer harms men by causing the uncontrolled growth of abnormal cells that destroy healthy tissue, disrupt organ function, and, if not treated early, spread, metastasize throughout the body. Men are more likely to develop and die from cancer than women, partly due to higher rates of smoking, alcohol consumption, and a lower likelihood of seeking medical help. Physical impact and organ damage. Prostate and reproductive system. Prostate cancer is the most common cancer in men, leading to symptoms like difficulty urinating, blood in the urine or semen, and pain in the hips or back. Testicular cancer, common in men aged 15 to 35, causes lumps, swelling, or a heavy feeling in the scrotum. Lung and respiratory function. Lung cancer, often caused by smoking, is the leading cause of cancer death in men, causing chronic coughs, chest pain, and shortness of breath. Colorectal and digestive system. Colorectal cancer can cause bowel changes, rectal bleeding, and, in advanced stages, blockage of the digestive system, causing malnutrition. Generalized harm. As cancer spreads, it causes severe systemic effects, including extreme fatigue, unexplained weight loss, and fever. Functional and long-term effects. Sexual dysfunction. Treatments for prostate cancer, such as surgery or hormone therapy, androgen deprivation, often lead to erectile dysfunction, infertility, and loss of libido. Incontinence. Damage to nerves around the prostate during treatment can cause permanent or temporary urinary leakage. Physical limitations. Bone cancer or advanced prostate cancer that spreads to the bones can cause debilitating pain and reduced mobility. Psychological and behavioral impact. Ostrich factor. Men are statistically less likely to visit a doctor for early, subtle symptoms, which can lead to delays in diagnosis and higher mortality rates. Mental health. A cancer diagnosis can cause significant psychological distress, including depression, which is particularly prevalent in cases like pancreatic cancer. Common cancers in men. Prostate cancer, highest incidence but often slow growing. Lung cancer, leading cause of death. Colorectal cancer, third most common with rising rates in younger men. Skin cancer, melanoma, highly common, especially for those working outside. Testicular cancer, most common in younger men, 15 to 35. How does heart disease affect men's health? Heart disease is the leading cause of death for men, often acting as a silent threat that causes damage through coronary artery disease, heart attacks, and heart failure, causing plaque buildup in major arteries, reducing blood flow to the heart, causing erectile dysfunction, and leading to sudden cardiac events. Heart attacks. Men often experience these via intense chest pressure and pain radiating to the left arm. Erectile dysfunction, ED. Heavily calcified arteries, a sign of heart disease, can lead to ED, making it an early warning sign of underlying cardiovascular issues. Sudden death. Half of the men who die suddenly from coronary heart disease had no previous symptoms. Heart failure. Weakened heart muscles lead to fluid buildup in the lungs and legs, causing chronic fatigue and shortness of breath. Earlier onset. Men typically experience their first heart attack about 10 years earlier than women. Arrhythmias. Irregular heart rhythms can develop due to insufficient oxygen flow to the heart. Warning signs in men: chest pain or pressure, angina, pain in the shoulders, neck, or arms, shortness of breath, extreme fatigue, cold sweat and dizziness. Are there solutions? Call Bruno Gogi 072-597-1726 to give you NMN, the best antidote for men's challenges. We also have Doctors Plaza if you want full body scan across East Africa.